Now let's talk about the muscles from a profile view of the torso. This would be the rib cage. So because we're drawing from the side, I've curved it a little bit. Your sternum is going to be on the side. That arch from the rib cage from the side. Okay. Now your pelvis isn't just going to be straight across, right? It's going to have a little bit of a curve to it because it's going to follow the spine. Okay. So that iliac crest, coccyx, going down to that pubic bone. Okay. So a little bit of a tilt, right? A lot of people have pelvic tilt, which you can correct with exercise because it can lead to back pain. We have this S curve for the spine. Now, what did we learn? That whatever the spine does, the linea alba does. Even though it's not a bone, we will need it. Right, I put a little indentation for a navel. Right. Rib cage, pelvis. So on the pelvis we have that iliac crest, and in the back, half of that triangular bone, the sacrum, sacred sacrifice, right? I'm not going to include the arm, I'm just going to cut it off like a cartoon ham, right? So we know that the shoulder is there and that the humerus would normally be there and an arm would block our view, but we're going to take the arm off so that we can see what's going on. Okay. That spine continues up, changes direction at that 7th cervical vertebrae, and it becomes that nice graceful curve in the neck. Right, so just for the sake of having it here, right, that's our little head. Okay. Our clavicles in horse perspective. And our scapula in the back, that triangular muscle, or triangular bone, excuse me. So remember how I said that there's no muscle protecting the very edge of your shoulder. So it's this box of bone called the acromion process. So the acromion process is this little box. Here, we'll talk about it more specifically and we'll zoom in when we talk about the muscles of the upper arm later on. So we have our scapula, that 7th cervical vertebrae, our spine, our sacrum, iliac crest, our coccyx, our ischium, we have the linea alba, we have the clavicle, we have the sternum, we have the arch of the rib cage. Let's put in a few ribs. So we can talk about these little tiny muscles that are connected to one that we already know. We know that the latissimus dorsi starts in the small of the back and comes up to the armpit. And it cuts across the ribs in a really beautiful, almost spiral kind of shape. Look for these wrapping muscles, almost like a barber pole, right? Those wrapping lines. This has this beautiful curve to it that I'll exaggerate a little bit more. And it just cuts through the ribs on top of them. And it's a beautiful line to look for when you're gesturing. Connected to and underneath the latissimus are these little tiny muscles that hook into the ribs These are called serratus muscles. You can remember it because serratus, like serrated, like a blade, like a knife, serrated, right? It's like little claws hooking in to the ribs, okay? We have our pectoralis major that we're gonna draw. That's superficial, large muscle of the chest, right? Big, powerful muscle. We have our oblique connected to the front of our iliac crest with very powerful muscle fibers going kind of backward. That's our flank, our oblique. We have our rectus abdominis muscles, right? So we have 1 pod, 2 pod, 3, maybe 4 pod. Remember, everybody's different when it comes to abs. Those are our rectus abdominis muscles, right? So we've separated them into their little quadrants, right? We have one more muscle that I almost forgot about because it's so small. Don't forget your teres major, like I almost did. That little football at the back of your armpit. Okay, these are the major superficial muscles from a profile view of the torso.